You are working with an FI2 in gastroenterology, and you are both in the bereavement office of the hospital filling out forms for two patients who have recently died under the care of your team. As you are entering the details of your patient, you hear the FI2 on the phone to the coroner's office regarding the other patient. You notice that he is missing out some of the details of the case and does not mention a recent endoscopy and biopsy performed on the patient. Choose the three most appropriate actions to take in this situation. A. Ask the FI2 to explain the case to you and discuss the importance of the biopsy in the report. B. Call the coroner yourself and give your version of the story. C. Call the medical examiner and ask them to review the case. D. Discuss the matter with your consultant to get their understanding of the case. E. Ignore the matter. F. Mention to the bereavement office staff what you heard and seek their advice. G. Take the phone from the FI2 in the middle of his conversation and tell the office that he is lying. H. Tell the FI2 after he has finished the phone call that what he has done is inappropriate. Answer. ADF. Doctors have a legal obligation to tell the whole truth to protect the patients even though they have passed away. The best thing to do, therefore, is to discuss the matter with the FI2 himself, A, or with someone more senior and more experienced than you. In this situation, that would be the consultant in charge of the case, D. The other people to talk to would be those most used to this sort of event. The bereavement office staff may be of help here, F. Calling the coroner yourself, B, would be overstepping your role and competence as an FI1 and should not be your first move. Ignoring the matter is not acceptable for obvious reasons, E, nor is taking the phone from the FI2, G. Simply telling the FI2 that he is inappropriate would only antagonize your colleague and is therefore not a good course of action, H. You are an FI1 working on a medical ward. One of your patients is being discharged after an admission with gastroenteritis, probably acquired from a takeaway restaurant. They ask you to sign a form to support their application to the local council for rehousing. They have cited health grounds as the reason they need rehousing and have written that they were admitted to hospital with an infection acquired as a result of living in a damp house. Rank and order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Confirm with the patient that they are really living in housing that is damp and in poor condition, then sign the form. B. Refuse to sign the form, and call the local council to get anonymous advice about how to report the patient to them. C. Explain that you cannot sign the form because the information they have asked you to verify is not true. D. Call the police and report the patient for fraud. E. Explain to the patient that you cannot sign the form because you are too junior, and they would need to ask a more senior member of your team to do so. Answer C, E, B, A, D. You should never sign a document if you know that it contains information that is not truthful and accurate, A. However, you cannot report the patient to the police, D, as they have not done anything criminal, so disclosing would breach their confidentiality. The only circumstance in which you could talk to an external agency would be to get anonymous advice, B, although this is unlikely to be particularly helpful as your approach must be dictated by your professional obligations. It would be best to speak to the patient directly, C, as you may even find that they are not being intentionally deceitful and actually believe that their housing issues are the cause of their illness. Even if they are aware that they are not being entirely honest, a simple explanation and refusal from you may be enough for them to realize that the document needs to be honest. Option E defers the situation to a senior member of your team, which is not strictly necessary but isn't unethical either. It therefore ranks higher than discussing with an external agency or signing the form. Options B and A.